Hello, my name is Brandon McElderry. I did my research presentation on the transcatheter aortic valve replacement, which is known as the TAVR. The TAVR is a procedure used to treat aortic stenosis, which is the narrowing of your aortic valve, restricting blood flow from your heart to the rest of your body. To understand what we're talking about, we need a general understanding of how the heart works. So here's a picture of your heart. And blood enters into the heart into the right atrium from your superior and inferior vena cava. And from the right atrium, it goes into your right ventricle, where it goes into your pulmonary arteries, which is basically pumping blood into your lungs, where the blood oxygenates. From the lungs, the blood dumps into your left atrium, and then it flows into your left ventricle. And this is where the aortic valve comes into play, right here. What the aortic valve does is it regulates the blood flow from your heart to the rest of your body. So aortic stenosis causes that aortic valve to narrow, and the blood backs up in your left ventricle, which enlarges the heart. So now your heart has to work extra hard to pump that blood out, which can cause heart fatigue, which leads to heart failure. So the traditional way to treat aortic stenosis is through surgical aortic valve replacement, which is basically open heart surgery, where the doctors create a 6 to 8 inch incision in your chest to access the heart, where they take out the defective valve and put a new one in. The problem with this technique is that high-risk patients have a tough time recovering from the operation, because it's a very intense surgery that lasts for about 4 hours, and the recovery time can be from anywhere from 2 to 3 months. What the TAVR allows doctors to do is access the aortic valve through the transfemoral artery, which is the artery that runs in your leg. And how they do this is they make a small incision in your leg, and then they insert a wire with a balloon attached to the end of it, and they run the wire all the way to the aortic valve through the artery. And then the balloon expands, opening up the aortic valve. And then the balloon is removed while the wire stays in there, and they use the wire as a guide for the new valve. And how the valve expands is from the internal temperature of your body cause it to expand, opening up the aortic valve. The benefits of the TAVR technology is that high-risk patients that weren't eligible for the surgical aortic valve replacement can now receive treatment for aortic stenosis. It also saves everybody money, because the treatment only lasts about an hour and a half, and patients usually leave the hospital within 72 hours. Due to the TAVR being a fairly new technology, it is not quite the preferred way to treat aortic stenosis, but with good statistics and success rates, it is slowly becoming the preferred method of treatment.